Hi, everybody. This is Life and Vibe, otherwise known as Ray. And today I'm going to take a look at our great friend, Sarasota Tim, and how he takes his blood pressure. Now, as a cardiac RN and somebody who has worked in cardiac nursing and worked at a cardiac rehab, I really do understand the importance of taking one's blood pressure. And especially taking it at home because you can be able to make sure that everything is good so that you can try to get an accurate reading, so you really do have a good idea of whether your medications that you have been prescribed are being effective, or you just yourself have been able to maintain good blood pressure. And we're actually going to go over how Tim takes his blood pressure and compare that with what the American Heart Association recommends in setting up a environment in which you can take a much more accurate measurement. And so there's a lot that I see that Tim has been unable to do to be able to get the best blood pressure reading. And so, yeah, it's going to be kind of fun to go over this. So, if you're not familiar with me or my content, my work is as a RN here in the United States, but I am trained to be a psychiatric mental health nurse practitioner. I do not treat or diagnose this creator, who I make often commentary around, mostly due to his more problematic behaviors. But I also get opportunities to review what people are doing around the health videos, such as this one that Tim has put out, and how he's reading his blood pressure, because he seems to also want to drum up some drama around why he doesn't like his doctors and why he doesn't think they're doing a good job and why he should be called Dr. Tim. We're not going to get into that in this video. Anyway, I have below, obviously, my fair use, because we're going to be using bits of this video that Tim put out the other day called Waking Up in Bed, Making Coffee. That's already one thing. Morning ritual. And we're going to take a look at his not the part where he's waking up in the bed, because that was all probably staged. We know he drove from his Tammy's and then put himself in that bed, because nobody wakes up in the morning and doesn't pee, Tim, especially somebody with like you with a urinal and a caffeine habit. That's enough to be a sufficient diuretic for everything. Anyway, all right, let's switch over my screen image and let me bring up this one that came from the American Heart Association, and I'll make sure to actually add this to the links down below so you can find it as well. So obviously, when we go to look at it, I'm going to raise the picture bigger so we can look at it. So we're going to take a comparison here, and we'll just see how many things that Tim does to try to make sure he's getting an accurate measurement, so he really can let his doctors know how well he is managing his blood pressure. Because there is an onus to do a little bit of, management. So, yeah. All right. I'm going to put Tim up to 1.25, as you can see, just because I think we can do this that way. And, take it away, Tim.
Here's to you. Man. Wow. Heavy whipping cream. McDonald's coffee, one tablespoon, heaping tablespoon, and one bottle of Walmart coffee. And folks, you get the best cup of coffee you ever drink in your life.
Okay, that sounds great, Tim. And we know
I feel it run through me all over.
And Tim's doubling down, as we know. Oh, and it's running all through him. Oh my goodness, Tim, your eye does not look good. I'm just saying, your eye does not look good, sir. Yeah, he had a stent put in his eye for his glaucoma. It just doesn't look good. And we haven't seen much of Tim today. I haven't checked in the last little bit, but Last thing I know, we only saw a video of him at a car wash, which makes me think that he's gone out of town somewhere and he's not wanting to have people show up in his mirrored sunglasses. So he's keeping a low profile. Anyway, let's take a look at this first part of this blood pressure monitoring. And so it does say, okay, in the 30 minutes before your blood pressure is taken, 30 minutes, okay? 30 minutes, okay? We're going to go in time here. So the first thing that Tim should do within 30 minutes, and if you've just woken up from bed, it's a pretty good time. But if you have a first thing in the morning coffee habit, which I personally do too, then if you really want to do your blood pressure properly in the morning, then what they suggest 30 minutes before, which is why it's good to do it sometimes first thing in the morning, because you've not done a lot of these things. So it's a good time to do it. Is first thing in the morning, before you've had breakfast, before you've had a cup of coffee, because you've got to be definitely having cleared 30 minutes. And so it's, you don't want to have been smoking. You don't want to have been doing any, exercise or anything that could have potentially elevated or even lowered your blood pressure if you got too dehydrated. No caffeinated beverages. So slurping coffee and saying it feels like it's running all through your veins, it's not recommended. It's just not recommended. And no alcohol. So that's just kind of what they recommend. And I don't think that Tim was within this 30-minute time frame. And so I personally, as a cardiac RN, used to always say to my patients, my recommendation to get just a good baseline and seeing, what you're waking up with in the morning, how low, how high, how effective your medications are. It's good to see your first thing in the morning blood pressure because you haven't had any of these things happen. If you need to go to the restroom, go ahead, go to the restroom, and you'll be taking your blood pressure. There's a couple of other things you're going to do within 5 minutes and stuff. So there's going to be a moment where you're going to get a chance to sit and kind of meditate, I guess, if for want of a better word. So anyway, let's get back to Tim and see what he does to get ready for his blood pressure check.
Now, I started taking in blood pressure pills again. Not the Stalins, though. Damn,
well, Stalins, which Tim refers to, are statin medications. He calls them Stalins. Anyway, they are not to address blood pressure, Tim. In a roundabout way, they will help with your blood pressure, but they are to address cholesterol. Obviously, having good cholesterol control and probably not having your arteries all clogged up is going to give better blood flow, which means that you probably are going to have blood pressure. But there's a lot of different things that can be reasons as to why blood pressure can be not well managed. And it's good to check. And there's been a lot of changes within the American Heart Association and the American College of Cardiology, and the list goes on about blood pressure parameters. And Tim gets confused at some point, and I think it's in another video, and he gets kind of like he doesn't know what's going on, and but he's Dr. Tim. Anyway, keep going, Tim.
Solid. And their leg cramps. I'm out. Let's go right here. I'll probably have to edit this part so you don't have to sit here for 30 seconds because I can't talk. I gotta check it.
All right, he is correct. He's just doubling down on that cup of coffee. So, obviously not stopping to drink coffee within 30 minutes, even if it's just ahead of the blood pressure, probably not a good plan. It's just no. The way the blood pressure cuff for this particular model, the way it's been set up, does not look like it would capture an accurate measurement. I can see that this arrow here, and I looked at it closer, says shoulder. So I think what they're trying to say is this needs to actually be on his lateral side and pointing up toward the shoulder, because this particular line here should be over the artery. There's no artery back here that the blood pressure is going to be capturing your blood pressure from. You need to put this over where the artery is, because that's what you shut off. And then when you release the cuff, it will read your milligrams per mercury of your systolic and diastolic blood pressure, what your blood pressure does on activity and what it does at rest. Like when it's going through it's like cardiac cycle, and then when it's kind of resting. So that's kind of what that's trying to show. But this cuff, because you don't, look, it has to see this line here, Tim, that should be coming down here, because that's what and that's supposed to be on your shoulder, not your chest. I mean, I know that's technically also the shoulder, but I'm trying to think it's going more outside, because this line isn't over your artery. I don't know what you're reading over back here. So I don't think you've already, whatever you're reading, that's not going to be accurate. Now, Tim is correct. You should not be speaking. So 5 minutes before you take your blood pressure, Tim, and obviously Tim would never sit still for 5 minutes. Rest for at least 5 minutes. Sit calmly and don't talk for 5 minutes, which Tim would find an absolute impossibility. While you prepare to take your blood pressure, relax, don't talk, rest your arm comfortably on a flat surface at heart level. And so I could see that Tim's arm wasn't quite high enough. You want to go up a little bit higher. So you actually, you want to be resting up that arm at heart's level. So you're almost like much higher up. People like kind of hang the arm down, and that's actually not the best way. You need to, I'll show you, because I'm talking and you can't even see me. I have the picture up anyway. It says, sit upright, back straight and supported. Keep legs uncrossed and keep feet flat on the floor. That's very important. You do not want to cross your legs, because that will actually cause change in your pressures. So yeah, you do not want to do that. You do want to make sure, though, that you are, he's got this straight. Obviously, you shouldn't be slurping coffee. You should be 5 minutes quiet, Tim. And sitting and being relaxed. It's a good time, like I said, before you drink your coffee. This is a really nice moment where you can sit and gather your thoughts of the day and relax and just sit calmly. Time it, 5 minutes. No talking. Relax. Make sure the blood pressure cuff is set up in the correct position. And then take your pressure. And I would always recommend take it twice. And make sure the legs, like I said, don't cross them. It will change the pressure. And relax. I don't think that Tim hit any of these. Okay, keep going, Tim.
I told you I got to shorten the video of it. I think that thing takes forever. 123/74.
Well, we can't really read that for accuracy, Tim, because you not doing the things. Well, one, the cuff isn't correctly positioned, so that is going to be already an issue. Personally, I think my sphygmometer died, but I have had somewhere. I should go pick one up. A cuff, and I just do it myself and listen to the stethoscope, because I have those skills. But these machines are fairly decent. I've used them at cardiac rehabs to be able to do pressures real fast with patients, so I don't have any difficulty. But I remember my patients would always be like, chomping at the bit for me to grab their blood pressures. And I'd always say, hey, I need you just to sit for like 5 minutes, no talking, just relax, and then I'll come grab your blood pressure. It's hard for people to want to do that. It's why often in the doctor's office, it's good if they just let you sit and chill out for a little bit. So that's a good thing, so that you can get a good, accurate blood pressure to your care provider. All right, let's get over here and take a quick look at what Tim should have done just before his blood pressure check right there, right before. We know he's already taken it, but anyway. So it says right before, place the bottom of the cuff above the bend of the elbow. So you see how they're sitting up a little bit higher? I don't think Tim's arm was up high enough. And wrap it against the, see, they're showing the line here. You know, it's usually more here. You follow the directions of the cuff, but Tim's cuff seemed to indicate it wanted his right here down the arterial, the artery and the vein that, you know, that goes there. You want to get that artery. You want to get that artery. Anyway, wrap it against your bare skin, not over clothing. So at least he did that. Okay. Oh, see, they said it right here. Take at least 2 readings, 1 minute apart in the mornings before taking medications. And in the evening before going to bed, record all results. Okay, so at least 2 readings, 1 minute apart in the morning. See, I said that. It's good to get 2 readings. See? Because you want to double, you know, it's just good. It's good. And do the same before bed. Does Tim take 2 readings? Absolutely not. Tim does not take 2 readings. He does not take 2 readings. His arm needs to be up a little bit higher too, I would say. I don't know if this comes down or he could just start to hold it. A lot of people can just hold it there. And or this gentleman's at a table. That's good. That table's a good height actually, because it will get it there. I recommend the left arm is good because it's the one that's closest to the heart. So that's the one that's often preferred. Sometimes we do it left and right because there's a reason. If you see very big changes in one to the next, it could indicate a potential cardiac condition happening at the time, condition happening at the time. And so it's important to actually do these things correctly. So if you've had a physician or provider say, hey, you should be doing your blood pressure management, I recommend that you take a look at this from the American Heart Association. It's got some good information and it will help you be able to get an accurate blood pressure. And it should be a couple of times a day you want to see, because before medications, and then after you've taken your medications, you've gone all day. How high is your blood pressure? How high has it become? Are you getting good control? And these are things that you should be recording down on a book, and it will help.
Doctor said 120 to 125, the top number. So it was like 130s or something like that, 133. For a few days, and I said, all right. He told me after 2 weeks, if it doesn't come down to between 120, 125, call him. He wants to increase the blood pressure strength.
Well, I would also think that your doctor may want to ask you, have you added more exercise to your routine? Have you started to take care of your sodium intake? What things are you doing to help manage your blood pressure? Because there are things that obviously you can do. And I don't think Tim is getting an accurate reading here. He looks very unimpressed. I don't think necessarily as a provider, you're going to jump immediately. I mean, that's something that they may say is a potential possibility if they can't get good control for you. But I think it's also important to look at other factors that could be leading to high blood pressure. It could be stress, can be very influencing into how somebody's blood pressure is. It could be if you're ill, if you have any pain, illnesses, if your tooth are hurting, Tim, and you're not comfortable in your mouth, that could have increased your blood pressure. There's so many different things. So that's why it's good to keep a good log and then follow up with the provider when they say, rather than just jumping the gun, Tim. And I don't think a good provider would jump the gun with you. But I don't think you're collecting good data, or data, however you want to say it. All right, let's see what else they said about getting this set up. I don't want to make this too long, but I find this stuff interesting. So yes, you're supposed to take those 2 readings and it will give you all those different types of results. If you notice that one arm shows a higher reading than the other, use the arm with the higher reading. So that's good advice, actually. So if you find that your right arm is giving you the higher reading, then that's the arm that you want to take. So I don't know if Tim's tried both arms. It's good. It's good information. And make sure you record which arm it was taken on, because that would be good information, helps the physician potentially or care provider identify potential sources of diagnoses to begin to investigate. Then, if your blood pressure reading is higher than 180 over 120, oh my gosh, yeah, that is bad. And then you're supposed to wait again and take your blood pressure. So, yes, that's not good. Tim, fortunately, is not that, but it could be experiencing signs of possible organ damage. Also, like chest pain, shortness of breath, back pain. Oh, yeah, that's not good. There could be all sorts of stuff going on. Okay, now the American Heart Association recommended blood pressure levels, and these have changed recently, so it's good to become familiar with them. Normal is under 120 and on your top number or systolic, and then less than 80 on your diastolic or your bottom number. Elevated would be considered between 120 to 129 and less than 80. Now, if you are on medications, there is potentially a different parameter that your provider has set. But this is what would be what if you were starting to do a plan for your patient. This was what the American Heart Association would recommend. This was released in July of 2024, so it's very up to date. And so potentially you would want to have the goal that the patient is lower than 120. Especially if you're giving them medications to manage it. It just depends. Now, you could have other things going on where maybe they don't want you so low because you're aging, and that could potentially lead you to be more lightheaded and get more dizziness and therefore be more prone to falls. And so we have to consider that as care providers, potentially all sorts of things in order to make sure that the pressure is one that is appropriate for the patient and adequate to keep them safe also, but also be good for their heart as well at the end of the day. So there's lots of things to consider. Obviously, high blood pressure is anything now between 130 to 139. And I think people used to be pretty comfortable with just saying anything under 140 and their blood pressure was good. And that has showed over time and with studies that that's not the case. I know other people are trying to say about this Cochrane review, but this is what the guidelines are that we as providers would currently follow. And they have had evidence-based studies to indicate why this is better for our hearts. And we've been actually going and allowing people to get too high. And then the other, we have all the different stages of hypertension or high blood pressure, 1, 2, and 3, and then one which is crisis, which is the one they showed over there. All right, not to get too much into that, because I know I find this interesting, but maybe not everybody does. So, all right, let's let Tim finish off, and then we'll say, I hope everyone is taking good care of their hearts and getting lots of good exercise. And, there's lots of things that you can do. And if Tim actually gains some of the goals of his weight loss, he actually could potentially lower those blood pressures down, because there is a correlation of that upper number coming down 10 milligrams mercury for every 10 pounds somebody is able to lose. So there is a really good correlation between the goals of having some weight reduction and it benefiting the lowering of someone's blood pressure.
I just said, let me just try go back on the 50s that I take that he's got me on. And that seems to be holding. So looking around, got my laundry detergent and Downy fabric softener.
Okay, so I guess that's the hint of Tim just telling us about his blood pressure, guys. So yeah, I hope everybody is able to keep their blood pressure well maintained, and that you're following up with your care providers and not following Tim's advice on how to take a blood pressure. I'm glad he is taking his blood pressure, but I think it would be beneficial if he took the time to maybe look at something like this particular guideline. The video is obviously very performative. I don't think he's getting good data at this time. I think that he should, if he really is serious in reducing his blood pressure, I think considering all the different things that could raise somebody's blood pressure, and then obviously considering what the goals are of your physician would be important. I think it's always good for our patients to take time to educate themselves also. But from resources like from the American Heart Association, not Sarasota Tim. All right, guys, if you did get this far in the video, if there is any type of like blood pressure emoji or a blood pressure cuff or something like a heart, anything to do with that, leave that in the comments below if you got this far. If you did like this type of commentary and content, make sure to hit the likes, make sure to subscribe, double check if you're still subscribed. I think YouTube has got, everyone's been complaining. So even Tim, and maybe at some point we'll get into the video where he does that. I certainly want to cover as a real cardiac RN, the one where he's going off about his doctors just not knowing anything and that he's Dr. Tim. Please, folks, be very wary of anybody on the internet, especially somebody who finished their education at 16 and is just spreading all sorts of myths and misinformations about the healthcare industry and about providers. I almost feel like I want to get in touch with his actual like PCP or whoever the NP is who cares for him, and just let him know how negatively he speaks about his providers and how he really just does not appreciate the work that we do, the years of training and dedication and time alone and time to sit and study that we do not get to see our friends, our families, our loved ones often. And I think it's important to recognize that people such as he, because he's not well versed in taking care of his health, because he's not somebody who was able to see himself paying for health insurance, he is so scared of the healthcare industry and doctors, because if somebody knows more than Sarasota Tim, I think he finds it threatening as a narcissist. And so I think that it is something that makes him uncomfortable, and he is just ripe for all of this misinformation that goes around, and he's somebody who perpetuates it. So just tread with caution with creators like Sarasota Tim. All right, guys, I've talked enough. I got a little soapbox there at the end, but anyway, I'll catch you on the next one. Make sure to subscribe, hit the likes. We'll see you on the next one. Bye.